New vendor audit process. So you're a new vendor, you've read everything, you've done your pre-audit, and you're ready for somebody to come in. So how this happens, our open enrollment periods are January through February and June through July, and any other time of year if we can work it in. So you have initiated contact, or you're going to, with the cell waiver staff responsible for vendor enrollment, and the cell vendor enrollment staff will provide information for self-audit of readiness to enroll. They'll give you the waiver scope of services for personal care, respite care, and personal assistant services, and outline the administrative and personnel requirements and responsibilities and the reimbursement rates. Vendor reviews the scope of services. The vendor is the DSP, direct service provider. Vendor are interchangeable terms here. The vendor reviews the scope of services, requirements, and responsibilities to ensure understanding of the program. The vendor self-audits to ensure administrative, staffing, and training practices for congruence with waiver requirements. Pre-enrollment audit, let's look at that. When a vendor has the prerequisites in place and understands the scope of services, you'll contact our vendor enrollment staff to arrange an on-site audit. The sales staff will schedule an initial visit to review administrative and personnel practices of the vendor direct service provider. The sales staff will conduct an on-site visit to all prospective DSPs. Findings from the initial audit may require subsequent audits before readiness can be established. The prospective DSP must be found to be in compliance with all state and federal home and community-based services waiver regulations before entering into a memorandum of agreement. And once you have an active MOA, you can begin accepting sale referrals. Pre-hire responsibilities. A statewide background check will be required for all service employees and for any employee who operates within the state of Alabama and has access to client records. Branch office employees, including non-visiting employees employed by the DSP and who have access to client records, are required to undergo background checks. Out-of-state corporate office employees will not be required to have a background check. Areas of the initial audit. Key staff, for example, the administrator, supervisor, must be present during the audit. An organizational chart showing chain of command that is accessible to staff, an annual budget. If DSP has a change of administrator, address, or phone number, will sales staff notify. Proof of operating capital to cover at least 6 months of expenses. Again, it's not going to take 6 months to be paid, but you need to be able to cover that. A minimum of 3 months of bank statements, proof of liability and workers' compensation insurance, DSP supervisor who is immediately available by phone with posted contact information. Written policies and procedures manual available in office. A policy and procedures manual section on business hours and policies. Note that the office cannot be closed for more than 4 consecutive days unless a holiday falls in conjunction with a weekend. The policy and procedure manual section on after hours and holiday on-call coverage, on DSP's emergency plan regarding service delivery, on hiring practices, on infection control procedures and ongoing infection control program, including training, on TB policies and TB procedures and training, on initial and annual in-service training. You note that in-service training must be approved by cell waiver program specialist. The policy and procedure manual must have a section on HIPAA and client-patient confidentiality, a section on client and patient complaints and grievances, And note that you must have a complaint log specific to sale and a means of following up and monitoring received complaints, which is documented in the log as well as in the client file and the employee file. Where is an appropriate place to conduct business? What is an appropriate place to conduct business in a private home? A room specified for the business must be separate from the personal dwelling area in a home. The room must be designated as a workspace and can be closed off from the rest of the house. Furniture, equipment, and supplies shall be distinctly related to a business office. Bedroom furniture, clothing, gym equipment, etc. shall not be stored in this space. Business and confidential files must be kept in a locked file cabinet. Children, friends, and family members shall not use or occupy the office area unless they are employed by the business. A telephone line with phone numbers different from the home residence is required. This number shall also have a voicemail or an answering service. A sitting area must be included in the office space to meet with clients and business associates, as well as with prospective and current employees. Personnel. All employees must meet employee requirements. They must meet worker training requirements. You have to have proof in a copy of statewide county and municipality background checks on all employees. Proof and copy of the National Sex Offender Registry checks. All states must be checked. Proof copy of Alabama Certified Nurse Aid Registry checks. Background check and orientation training must be completed before the worker can be placed in service. Before they can go in somebody's home, they have to have passed all of the background checks, gone through your whole hiring process and your training process prior to going into someone's home. The non-medical vendor application packet includes a vendor self-service, VSS, system directions, non-medical vendor application, non-debarment certification, non-discrimination certification. These are agreements that you're signing off on in the application. Compliance with the drug-free workplace, assurance of registration with Department of Revenue, Ethics Commission form, and immigration status form, and that must be witnessed. In addition to completing the forms and registering in the vendor self-service system, you must provide your IRS W-9, a copy of the business license, copy of certificate of liability insurance and workers' compensation coverage, and other applicable professional licenses, certifications, etc., such as RN or LPN licenses. The DSP must electronically enroll in the STAR system and provide sale with the resulting VC or VS identifier before the ADRS vendor application package can be processed. If any information is missing, the vendor will be notified and the missing information must be submitted within 7 business days of the notification. If the vendor does not provide the information, the application will be returned to the vendor. No application will be processed that does not contain all of the required documents, forms, and/or other information. When the application process is complete, it's when the vendor has met all criteria set forth in the sale waiver scope of services, has successfully completed vendor training, has successfully passed a pre-enrollment audit, has completed a STARS application, and has fully completed and submitted a vendor application. The process of awarding a memorandum of agreement begins. The initial memorandum of agreement may be for a 6-month provisional period in order for the vendor to fully demonstrate the ability to perform in accordance with regulations and guidelines. However, most MOAs are for a 3-year period. As described elsewhere, the vendor must return 3 originals of the MOA and all attachments, all signed, initialed, and marked in blue ink. The MOA is reviewed by the accounting and legal departments at ADRS. The MOA is then submitted to the ADRS commissioner for signature. The MOA, along with a request for a certificate of need, is then submitted to the Alabama Medicaid Long-Term Care Division Director for review. Once the MOA has been signed by the commissioner and the con letter has been signed by the LTC Division Director, it will be returned to SEL. The ADRS accounting office will be notified and all necessary forms required by accounting will be sent to the Chief Financial Officer. Once you're ready for business, if the vendor is placed on the vendor choice form with a provisional MOA, an audit will occur 45 days prior to the end of the provisional MOA. If they complete the audit successfully, they will receive a 3-year MOA. If the vendor has a 3-year MOA, an audit will be completed every year and will be performed at least 45 days prior to the end of each year of the MOA. At that time, it will be determined if the vendor meets the requirements and the MOA process begins again. The SEL staff will complete a monthly review of the AMA's website and Office of the Inspector General's website to ensure the owner and any other professional staff identified have never been debarred. If at any time during the application process, the MOA, or during the provision of services, the vendor has been debarred, SEL will terminate the vendor immediately.